Hi, my name is Harveen,
I'm Jessie.
And I'm Althea.
and today we'll be talking about the social interventions to promote HPV vaccination among 9 to 17-year-olds. So, HPV is the most common STI in the United States, impacting almost 79 million Americans, causing 3% of all cancers in women and 2% of all cancers in men. And we found that a two-dose series of HPV vaccines can eliminate 90% of all HPV related cancers. And that due to the sensitivity and stigma surrounding the topic, the HPV discussion is usually left out. So, our study is closely related to the United Nations Sustainable Development Goal number 3, good health and well being, as we aim to find the most effective social intervention in promoting first and second dose HPV vaccination administration among 9 to 17-year-old adolescents. And I'll pass it away to Althea.
So we conducted a meta-analysis study where we analyzed 4 different intervention methods, such as A, physician reminders, where participants were divided into 3 different groups, B, in-school vaccination programs, and here participants received a vaccine at school. C, clinic educational materials, where participants either received usual clinic care, tailored or untailored materials, and D, text reminders, where participants either received an untailored or tailored text message. So we filtered the data specifically for an age range of 9 to 17 because this age range has been proven to be the optimal ages for HPV vaccination. And we compared the intervention methods using a stacked bar chart, and Jessie will elaborate more on the results.
What we found is that the in-school vaccination program is the most effective intervention in promoting both doses of the vaccine, ranging from 61% to 56% respectively. And the least effective was the text message reminder at 16 to 7%. Interestingly, for in-school vaccine programs, individuals who got the first dose came back to get the second dose, thereby completing the entire vaccine series. And this is unique because we don't see this level of consistency with other vaccine interventions, such as with the physician reminders. The effectiveness of in-school vaccine programs is attributed to the fact that they positively impact parental attitudes towards HPV vaccine safety, and also decrease barriers like transportation time, appointment scheduling, and vaccination fees. In contrast, text reminders are very passive and offer no education on HPV vaccines. So why are these findings important? That's because in-school vaccine programs are able to reach adolescent populations at the most optimal age of vaccination, which is around 11 to 12 years old. And now to Harveen for the limitations.
Thank you so much, Jessie. So, to summarize the limitations of this research, there were notable errors in data collection, such as the absence of population representative strata, variability of sample sizes, and the absence of a control group in the in school vaccination intervention. And I'll pass it on to Althea.
Despite the increasing HPV awareness, HPV vaccination rates have not caught up to other vaccine coverage rates, and societal stigma is a big reason for it. We need to open up discussions about STIs and stop the misinformation. Thank you so much for listening to our presentation.